A spike in whooping cough cases south of the border has doctors warning Canada could be next. This year, the U.S. has recorded 25,000 cases of whooping cough so far. That is a 34% increase from before the pandemic in 2019. For more on what a surge could mean for us here in Canada, we are joined by Dr. Alon Vaisman. He is an infectious disease physician at the University Health Network. Good to have you here this morning.
Hi, thank you for having me.
So those whooping cough cases started increasing in the U.S. after the pandemic. So what factors are driving this current uptick?
There's theorized to be a few factors that are driving the increase in the whooping cough cases. Firstly, it's thought to be that because whooping cough is transmitted due to close contact, there was less contact during the pandemic. So when you return to more close face-to-face contact, there's going to be an increase in cases. The second is there's probably some waning immunity as a result of less exposure to one another. And secondly, also because of perhaps less vaccination during the pandemic. So particularly for young kids where multiple doses of the vaccine are required, some people were not keeping up with the vaccination. And on top of that, with all the anti-vaccine sentiments that have been going on, that also contributed to less immunity. So putting all those factors together, there's seen a rise in the cases, but most notably, it's much higher than it was pre-pandemic at this point.
Yeah, this year whooping cough outbreaks were even declared in parts of Nunavut, but we're not seeing the U.S.'s volume of cases on a national level. Why are you concerned that could change?
Many of the factors that affect the U.S. are the same that affect us. So, for example, the anti-vaccine movement also affects Canadians. We've seen a drop in other forms of vaccination here. We see the measles outbreaks that occurred across Canada in early 2025. So a similar thing could happen with whooping cough. The second thing is also a lot of travel between the U.S. and Canada. So transmission of the infection can occur due to exposure of the bacteria. So those are the two factors that affect both of us combined. So when we see what happens in the U.S., it's very likely to happen here in Canada as well.
The whooping cough vaccine, we know, is delivered in intervals, and the Public Health Agency of Canada is recommending that kids who receive a dose of the vaccines at 2, 4, 6, and 18 months old. PHAC also says children should get their next dose when they're between the ages of 4 to 6 years old, and then another when they're between 14 to 16. Adults are recommended to get a booster after they turn 18, and pregnant women need to get vaccinated 27 to 32 weeks into their pregnancy. I guess I'm curious, how well are Canadians keeping up with this vaccine schedule? It's a lot.
Yeah, and that's what makes it different from many of the other vaccines and vaccine-preventable illnesses that we've been talking about in the last few years related to the pandemic. But this one is a little bit more complicated, requires a lot more doses, and there's more likely that if you miss doses, you're going to have waning immunity. So during the pandemic, access to pediatricians and family docs was challenging. But if you think about where we're at now, getting people, adults, adolescents, and then adults to get vaccinated again when they're older is very challenging. So that's why there's a susceptibility for the bacteria to come back, to make a resurgence, and to start circulating more often.
In my 20s, I hit one of those windows where I was not protected. I got whooping cough. I will tell you, it is horrific. It took me a year to recover from it. It is awful. I can't imagine it hitting somebody who is immunocompromised, older, or very young. It is not the only vaccine-preventable disease that doctors are concerned about. Last month, the Pan American Health Organization revoked our measles elimination status. You know, we covered that a lot here on the show. Why are we at risk of whooping cough becoming the next measles?
Yeah, the numbers of the whooping cough are even higher, and the way that it transmits can be quite significant. And we have a lot of cases here that can move back and forth with the U.S. So a similar kind of thing that we see reflected with measles can certainly occur with whooping cough. And because the measles vaccine has fewer doses and having to get more people more doses for the whooping cough, there's a greater risk for the transmission to just keep going. So there needs to be a concerted effort across the nation and the provincial health units to focus on getting those doses to particularly the children, like the infants, the newborns, and then also to the adults. I mean, having a public awareness campaign is going to be quite tricky in that population because there isn't that same framework where you have kids go for well baby checks. We don't have that same framework for adults.
Doctor, really quickly, because we don't talk a lot about pertussis or about whooping cough, how contagious is it? Remind us.
Compared to measles, it's not as contagious, but certainly household contacts is where you see most of the transmission occur. It's not generally as well transmitted in hospital settings or in settings in public, like in the subways or in public areas. But between household members is where you see it most commonly transmitted. And the way it's transmitted is through droplets, so coughing and sneezing from one individual onto the mucous membranes of another.
Yeah, Dr. Vaisman, infectious disease physician at the University Health Network. Thanks for joining us this morning. Appreciate it.
Thank you.